Hi, I'm Dennis Galluzo. I wanted to thank the Louisville School of Pharmacy for giving me the opportunity to speak to students today in regards to what constitutes a good pharmacist. In regards to the chapter that I wrote, what pharmacists, physicians, and nurses and patients think about pharmacists. I wanted the students to know that part of, I believe, what goes into becoming a good pharmacist is being active in your community. And certain characteristics, virtues, and habits of pharmacists obviously are not ubiquitous. That there are pharmacists that feel that their profession is limited to what they do in particular. As a pharmacist throughout the year, I believe it's very important for students and pharmacists, people in the profession, to be active within their profession. And consequently, that led me to wear a lot of hats voluntarily. As a pharmacist in the community, I am the Executive Director for the Pharmacist-Association of Western New York. I am on the Erie County Board of Health as the only pharmacist on the board. I'm on the Western New York Adult Immunization Coalition as the only pharmacist on the board. And I am the volunteer pharmacy lead for the executive committee on the Specialized Medical Assistance Response Team, the SMART team, as a pharmacist. And I believe all of that is part of being what, for me, constitutes being a good pharmacist. So, in relationship to some of the things that were read in the chapter, certainly I believe that this book is very good for students to read, because I believe that in general, what pharmacists are saying about other pharmacists absolutely applies. That a good pharmacist should be an expert. Patients want to hear what a pharmacist has to say in layman's terms. Very important that we counsel patients. I've done that for many years, and I, as a pharmacist leader in the Pharmacist Association of Western New York, have gone to the state to actually have the counseling law changed back in '99 to make it mandatory that pharmacists counsel all new prescriptions. And I think that in counseling a patient, that adds to your professionalism as a pharmacist. What you should know, I believe, is that when you counsel a patient and you tell patients about their medications, that you now create a bond with them. And that bond is something that really should not be broken, and that's why we as pharmacists are against mail order. But I digress, so I'll go on with it. So in saying that, to address what people think about pharmacists in a professional manner, that's one of the reasons why students are given a white coat in the beginning of the teaching in pharmacy schools. The reason for that is that pharmacists should always look and act professionally within their setting. And in so doing, you portray yourself as a professional to the patient, and the patient, in so seeing that, will be more apt to communicate with you on that level, and see you as a professional and go to you as a professional. Regarding a work ethic, I think the most important thing for you as a student to understand that, of course, pharmacists are hardworking and resourceful and precise and result-oriented. That's the most important thing to me, is that you're result-oriented. Regarding the work ethic, I think that pharmacists, and I tell this to my technicians and my students and my interns all the time, if you're going to take care of patients and you need to take care of them as a professional, you need to do whatever it takes. Take that second step, the third step, the fourth step, the fifth step. I don't care how long it takes. You need to do the right thing by your patient and make sure that they get the proper medication. And that means you're going to be doing a lot of fighting with insurance companies. You're going to be informing doctors of what the patient is on, because you're going to look at their profile and you're going to consult them. And sometimes you're going to find things that may or may not be appropriate for the patient. And I think that's the most important thing. You can show to them how you're a hardworking individual, and this is somebody that is going to take care of me, oh my God, that pharmacist, what a problem solver he was. He went there, you need to go to him because he's the guy that's going to solve the problem. I had a problem with an insurance company and he got it for me. I had a problem with my medication and he helped it become something, he changed it with the physician. So those are the kinds of things that add in to you as a professional and add to your character. Now, as far as characteristics go, strong characteristics of a pharmacist should be that they're mature, supportive, and dependable. This all goes back to counseling the patient. If you are counseling the patient, they're going to know what kind of person you are just by the way you act and talk to them. That bond will then be reinforced, and this adds to what? You become what's known as the most trustworthy professional in the marketplace. This goes to the Gallup poll that recently has come out, and in recent years, we used to be the most trusted professional in the whole professional aspect of different people being out there as professionals, meaning pharmacists, doctors, lawyers, firemen, nurses, and until 9/11, we were in the top 2 or first. But now that 9/11 has come about, firemen are the most trustworthy people on the marketplace. But pharmacists are always in the top 3. So the reason for that is because we've developed a bond with our patients, and that's why we are noted as being trustworthy. And I think that's the most important thing that you can have as a moral or characteristic. A moral characteristic for you should be that you're trustworthy and sincere, and that you take care of the patient, and in so doing, what have you created? You have a patient-oriented pharmacist now who now has empathy for the patient. If you show that you're concerned about their medicine, if you show that you're mature about what's going on, that you have some experience with what's going on, you will now have created a characteristic in yourself that you are now a person with empathy. The most important thing that I think that you can have for your patients is empathy. And I think all these particular attributes, patients seeing you as seeing you as a knowledgeable, empathetic person who's going to take care of them and get the job done. And I think out of all of the things that you could possibly agree with, all the other pharmacists, I think that being knowledgeable as it relates to counseling and getting results and having empathy for the patient is a culmination of what I believe is going to make a good pharmacist. And that's basically, I think, the most important thing that I can say to students today. And make sure that you get involved with your profession. The more involved you are with the profession, the more apt you're going to be a better pharmacist, because you're going to be more knowledgeable about what's going on. So not only you should know your therapeutics and your clinical side, but you also should be a person who knows about what's happening in your profession. I've won a lot of awards in New York State and in the Pharmacists Association, but it's only because of my involvement, my ability to go out into the workplace, my ability to continue to learn. Once you leave the school, you have to continue to learn. You can't just say, rest on your laurels, and you've gotten your degree, and now you're going to go out into the community and you're going to become a pharmacist, whether it's in the managed care or community pharmacy, whatever it is. I made pharmacy history with the UB School of Pharmacy, with the Erie County Board of Health as a supportive people. We as pharmacists finally, in 2009, were able to immunize. I was the first pharmacist in New York State ever to do that. And I've got to tell you that I was in my late 50s when I had to go out and relearn all of the different things that we had to learn, the 22-hour course for immunizations. I had to learn that. And I took it upon myself to be one of the pharmacists in the community to go out and learn that particular aspect of my profession, because now I've increased my scope of practice. You cannot stop. Science changes every 5 years, they said. So you have to move with the times. Make sure that you keep up with your profession, get involved with the new things that are happening in the profession itself. And so immunizations was the one thing that I did on the professional side as far as a clinical thing. We were the first pharmacy, Family Medical Pharmacy was the first pharmacy ever to do a clinic in New York State. I was the first community pharmacist ever to give an immunization in New York State. And we were proud to have done that in the year February 7, 2009. The law was passed late in December of 2008. And as executive director of the Pharmacists Association, I went out and learned what I had to learn to create those tools. I created the consent form and record for all the pharmacists to use. So it's not something that you should be doing just for yourself, and you should be doing this also for your profession. And do things in the community, and you'll be more happy, you'll be a better pharmacist, and you'll be an asset to your profession. Thank you.